Hey, welcome back to Open. I am your host, Darren Jaime. According to a recent article in the New York Times, many people, primarily between the ages of 25 and 45, in high-pressure jobs, take ADHD drugs, such as Adderall and other stimulants, in the belief that it helps them stay focused and on top of their game. But that could be causing them more harm than good. Here now to tell us more is Barnabas Hospital psychologist, Dr. Dylan Payne. We thank you so much and welcome to the show.
Hi. Nice to be here.
Good to have you. So when we talk about these who are working 25 to 45, a lot of pressure, a lot of stress, and really some people try to self-medicate, and what we're finding out now is these particular drugs, of course, are really doing some real significant harm.
Right. So these are medications that are intended to treat specific medical conditions, things like attention deficit hyperactivity disorder and other conditions. And what we're finding is a lot of people who don't have a medical reason for being on these medications are obtaining them in the belief that they're going to help with their job performance in some way.
Hidden under the guise that I can focus better, I can do better, I can work better.
Right, that I can focus more intensely when I'm on the job. I'll need to take fewer breaks. I'll be able to work longer hours. I'll be able to work more with less sleep. Those are generally the kinds of things I think that people are looking for when they're taking these medications for inappropriate reasons.
So when they take these medications, of course, we know that there's a certain health risk. Let's walk up through the risk, because some people say, oh, you know, I just do it. And as we look, it's a 20-year age gap, 25 to 45. Any reason particularly why we're seeing 25 to 45?
I think in a lot of ways that's probably because of that's sort of the demographic where people are familiar with these drugs. You know, people that are kind of in that age group grew up with more of an awareness of ADHD as a medical condition, maybe are more familiar with having seen kids when they were younger being on these drugs, and are just more aware of them in general. And so by being aware of the medications, maybe believe that they're going to somehow be helpful for them, even if they don't have one of those medical conditions.
Question is, how are people getting their hands on it, given the fact that you need a prescription?
Right. So there's probably a couple of different ways that people are getting these drugs. Some people are going to physicians and faking symptoms, essentially, you know, going in reporting symptoms that they may or may not have in an attempt to convince a doctor that they do have ADHD. There are probably also issues with doctors maybe not taking careful enough histories, not getting enough information to really make a proper diagnosis when somebody comes in with these kinds of complaints. And people are also buying them from illicit sources. These are drugs that get diverted out of the normal sort of retail chain and end up being sold by drug dealers. So that's another way that people actually obtain these medications illegally.
So if I walk into your office and say, look, doc, you know what? I'm really stressed out. This TV station thing has got me going crazy. It's hard being an anchor. 25 to 45, I'm falling in this age category. I need some help. I'm thinking about taking these drugs. You say what?
What I would do is go through a history of what exactly the problems you're having. You know, if you're having trouble concentrating, for example, how long has that been going on? Is that something that's been going on your entire life? Or is that something that's only really been going on since you took this high-pressure job where you're working, 12, 14, 15 hours a day? Are these symptoms that are only happening when you're at work? Do you have trouble concentrating, on the job, but you're fine in every other aspect of your life? Because somebody with attention deficit hyperactivity disorder is going to have symptoms whether they're at work, whether they're at home, whether they're hanging out with their friends, and they're going to have had symptoms more or less their entire life. They may not have necessarily been diagnosed, but the symptoms are going to have started when they were children and have continued throughout their life.
What are my options? Because obviously they're opting for these drugs that are illegal. What are my options when I have symptoms and I don't have to necessarily go this route?
Right. So probably for a lot of people who have these, who are having issues functioning in their job and they're looking for some way of helping with that. Psychological interventions would probably be very helpful for a lot of these people. Seeing a psychologist or a clinical social worker, somebody who can do psychotherapy with them and help them work on things like stress management techniques, anxiety management, those kinds of things that aren't necessarily reliant on a medication.
Are there tests to prove ADHD?
There aren't any sort of medical tests. We can't do a blood test. We can't do a CAT scan of your brain or something like that to demonstrate that you have this disorder. What we can do is administer questionnaires that are scored. So you give someone a questionnaire where they check off different symptoms and how severe they are, how often they occur, and you can get a little bit more well-defined information that way. But really what it comes down to for the most part is taking a very careful history, so really asking the right questions and making sure that this is somebody who truly has attention deficit hyperactivity disorder and isn't, just having trouble concentrating because they're working too many hours and not sleeping enough.
Now, for the person that's out there, they're taking the Adderall, they're taking these stimulants, it's important to say that these are illegal drugs, first of all. And not only that, somebody says, well, it's not such a big deal, but these are federal crimes.
Right. So obtaining any prescription medication without a prescription is a crime. So if you're using these medications and you're buying them from a drug dealer, you're committing a crime. And there's also potential implications if you're obtaining the prescriptions from a physician, but let's say you're visiting multiple doctors and getting prescriptions from different physicians. That also has some potential legal ramifications, and there's systems in place to try and stop that kind of behavior, because we have a registry now in the state where anytime a physician writes a prescription for any controlled substance like a stimulant, we go into that registry and check it to see what other prescriptions that person's been receiving, so we can see if they're getting prescriptions from multiple doctors, for example.
Side effects when you take these stimulants, what are they?
Okay, so the side effects can range from things that are relatively mild to things that can potentially be pretty serious. So common side effects of these kinds of drugs would be things like appetite suppression, insomnia, jitteriness, or sort of increased anxiety. Those kinds of things would be pretty common. More serious problems would be things like heart arrhythmias. So in larger doses, or for people that maybe have some kind of underlying heart condition, it can cause problems where you may suddenly go into a dangerous heart rhythm and could potentially that could potentially be fatal. They also increase the risk for seizures, especially at high doses. So people taking large amounts of these medications are putting themselves at risk for those kinds of issues as well.
And so we tell people to please, if you're doing this, stop, because obviously there's some very serious side effects. Not only is the side effects that's illegal, and is this a growing trend, or is this something that's on the uptick, or on the decline?
Yeah, so the information that's available seems to indicate that it's definitely a growing problem. The number of prescriptions for these kinds of drugs has been going up over the years, and in my own clinical experience, it was a fairly large percentage of the patients I was seeing when I was working in a private practice, were adults coming in with these kinds of complaints.
Dr. Dillon, thank you so much for coming and sharing with us, and certainly we appreciate having you.
Oh, thank you.